Last year, we had our very first ESICM Datathon. The objective there is to drum up interest and bring together the clinicians and data scientists. What we're hoping to achieve for the second ESICM Datathon is to promote data sharing for more intensive care units to start sharing their data and getting those data into the hands of as many brilliant investigators as possible. There are several messages that I imparted with this presentation. The first is the value of getting the data into the hands of clinicians and data scientists to derive new knowledge, to maintain a medical knowledge system, because at present, the medical knowledge system is far from perfect. And we think that the best approach in terms of fixing that system is an open, collaborative ecosystem around the use of data that is routinely collected in the process of care to contribute to the medical knowledge. Of the winning algorithms from last year, I am most excited about being able to predict whether a patient who's being admitted for bleeding in their intestines would need a blood transfusion or not. And the reason why this is an exciting algorithm is that perhaps there's no need to admit a lot of these patients to the intensive care unit. Most of the time, they come to the intensive care unit for monitoring. Most of them have stopped bleeding and would not require any more transfusion, and it's almost like an unnecessary admission to the unit. Having an algorithm that would tell us whether this patient is gonna continue to bleed and would require blood transfusion would allow us to perhaps admit these patients to the floor or even not admit them to the hospital. Being able to use this data would require you to process the raw data. A lot of organizations keep saying we have lots of data, but this data are for the most part like crude oil. They need to be refined, they need to be processed, and they need to be made machine learning ready. And we can only do that if there is use of standards, of nomenclature, of medical ontology, because that's how you're able to align the structured data and represent the concepts that you're interested in. So we're always pushing for the adoption of these nomenclatures and standards to make it easier for investigators to be able to really leverage the value of the knowledge contained from this data.